Welcome to this advanced exploration of the endocrine system, the body's chemical command center. Unlike the nervous system, which operates within milliseconds, the endocrine system influences metabolism, growth, reproduction, fluid balance, and stress response over minutes, hours, or even years. Hormones act as biochemical messages that travel through the bloodstream, bind to target receptors, and change cellular behavior. Dysfunction is rarely loud at first. It whispers through subtle vital sign changes, mood swings, weight shifts, skin texture, and metabolic instability. Nurses must detect these whispers before emergencies speak in organ failure. Start with the hypothalamus and pituitary axis, the master regulators. The hypothalamus senses the body's internal state, temperature, osmolality, nutrient availability, and signals the pituitary. This anterior pituitary releases trophic hormones, thyroid-stimulating hormone, TSH, adrenocorticotropic hormone, ACTH, growth hormone, prolactin, and gonadotropins, LH and FSH. Each cascades into a peripheral gland, TSH to the thyroid, ACTH to the adrenals, L and FSH to ovaries and testes. When hormone levels rise, negative feedback shuts production down, maintaining equilibrium. Clinical logic. When TSH is elevated but T3 and T4 are low, the thyroid gland itself is failing. Primary hypothyroidism. When TSH is low and T4 is low, the pituitary or hypothalamus is failing. Central hypothyroidism. The thyroid is metabolism's accelerator. It increases heat production, oxygen use, and energy demand. Hyperthyroidism produces heat intolerance, tachycardia, tremors, weight loss despite appetite, and anxiety. Graves' disease adds exophthalmos and autoimmune activation. Hypothyroidism slows the body. Fatigue, cold intolerance, bradycardia, constipation, hair loss, and cognitive fog. In severe cases, myxedema crisis, hypothermia, hypotension, hypoventilation, and coma. Give IV thyroid hormone, warm the patient, and treat hypoglycemia aggressively. Now the adrenal glands. The cortex produces 3 zones: mineralocorticoids, aldosterone, glucocorticoids, cortisol, and androgens. Aldosterone controls sodium retention and potassium excretion, thus blood pressure and volume. Cortisol raises glucose, suppresses immunity, increases stress resilience, and distributes fat centrally. Addison's disease is adrenal failure, low cortisol and aldosterone. Symptoms include bronzed skin, severe fatigue, hypotension, hyponatremia, hyperkalemia, and weight loss. Addison's crisis is shock with severe electrolyte imbalance. Treat with IV hydrocortisone, fluids, and dextrose. Cushing's syndrome is cortisol excess, moon face, truncal obesity, thin extremities, purple striae, bone weakness, hyperglycemia, and infection risk. Nursing care prioritizes glucose control, fracture prevention, and infection surveillance. The pancreas is metabolic homeostasis. Insulin opens cellular doors to glucose. Without insulin, the body burns fat, creating acidic ketones. Diabetic ketoacidosis presents with hyperglycemia, dehydration, Kussmaul respirations, abdominal pain, and fruity breath. Treat with IV fluids, insulin infusion, potassium monitoring, and address trigger, often infection. Hyperosmolar hyperglycemic state has profound hyperglycemia and dehydration, but no ketosis, often elderly type 2 diabetics. Fluid and volume restoration precede insulin. Parathyroid glands regulate calcium via parathyroid hormone, PTH. Calcium affects muscle contraction, clotting, cardiac rhythm. Hypocalcemia causes muscle spasms, tetany, Kvostek and Trousseau signs, and dangerous QT prolongation. Give calcium IV slowly with cardiac monitoring. Hypercalcemia causes stones, bones, groans, and psychic overtones. Renal stones, bone pain, constipation, lethargy, arrhythmias. Treatment includes fluids, calcitonin, and bisphosphonates. The endocrine system is pattern recognition, subtle cues escalating to catastrophic consequences. Nurses are gatekeepers of physiologic balance. When temperature rises, heart accelerates, or behavior shifts without reason. Think endocrine. When labs contradict symptoms, interpret feedback loops, not isolated numbers. When electrolytes fluctuate unpredictably, consider hormonal control, not simply fluid status. Endocrine mastery is not memorization. It is clinical storytelling. What hormone? Which gland? What feedback failed? Who is compensating? Where is the danger? Speak the language of systems, and the endocrine system reveals its logic.